Placental remains are even easier procedures to deal with. In fact, I've been doing retained products of conception removal since 2007. Generally you don't have to deal with the vascularity concerns, so there's not the bleeding concerns, there's not the concerns about fluid going into the system, no risk of congestive heart failure. They're generally short procedures. So I will go ahead, I don't give these patients antibiotics, I don't give these patients anything to restrict bleeding or cause vasoconstriction. I may go ahead and use something just to open the cervix the night before. That I think is good, is prudent, and makes the procedure even easier. But here is where I go ahead and use the window right on tissue. So I'm not bringing that tissue up the way I do with the first trimester loss, because a lot of times this tissue is more dense. It could even be calcified. It could be even deeper. If you're dealing with a procreta or increta or an accreta, you may have to go ahead and wedge into the muscle. So I'm going to work right at the tissue rather than bringing the tissue up. The long and short of it is that when one talks about a D&C doing this type of procedure, you can have up to a 30% risk of adhesions after the procedure. When I use MyoSure resection, I've had that is 0 adhesions post-op. So I think a very, very practical, efficient, and successful treatment.